It is just a huge honor today to be podcast interviewing the only oral surgeon in Ahwatukee for forever. I mean, I got here in '87 and you got here in '94. My gosh, I should know math. What's '94 to 2017? How many years is that?
23.
And I want to ask yourself, this is kind of interesting because when you live on Tukeetown, like, say you and your spouse needed a marriage counselor. Well, how many marriage counselors are in Ahwatukee? Is there 1? Is there 4? Is there 8? We'd like to go to each category and get them all. And oral surgery was the easiest one because I only have to talk to one guy, Greg Edmonds.
That's right.
And he's an amazing oral surgeon. I can vouch for that. He has a Bachelor of Science in Biochemistry from Washington State University in 1982. So that was in Seattle.
Pullman, actually. So Washington State is in Pullman, eastern side of the state. University of Washington's in Seattle.
Okay. So are you a Cardinals fan or are you still a Seahawks fan?
I am both.
You're both? That's a wishy-washy answer.
So this is the way it works. When they play, if it's the end of the season, I'm going to root for whichever team has the most to gain by that win. So if the Cardinals will get a higher seed in the playoffs by winning, then I'm rooting for the Cardinals. If the Cardinals aren't going to make the playoffs and Seattle's going to get a higher seed, I'm going to root for Seattle.
Well, I know exactly how you feel because I'm not faithful to the Cardinals either because I was born and raised in Kansas, went to dental school in Kansas City. When the Chiefs beat the New England Patriots the other night, I dented the ceiling twice. And it's always a tragedy when they play each other because my heart's for both of them. You got your doctor of dental surgery from Creighton University. We both went to Creighton.
Yep.
Jesuit school in Omaha, Nebraska. A general practice residency in the United States Air Force in 1987. An oral and maxillofacial residency at the University of Miami from 89 to 93. So you were down there when Andrew hit.
Yes, I was there when Andrew came through full force.
And did you evacuate, or are you one of the crazy ones that tried to write it out?
Well, because we were in our residency, they needed us in the hospital. So nobody that was a resident or a attending physician there could actually leave the area. And I don't know if they really even had a mandatory evacuation back then, to be honest with you. I don't remember, but certainly we stuck it out.
Did you guys see extra injuries because of the hurricane, Andrew?
Oh yeah, we saw a ton. Not because of the initial force and injuries to people that stayed through the hurricane. We saw injuries from workers that came down to help rebuild the city. And so there's, thousands of people that came down to help rebuild the infrastructure. And there was lots of industrial accidents. People falling off roofs, equipment falling on people. So a ton of facial fractures, which, is not right as it sounds, was great for my training because we saw any kind of trauma you could ever imagine.
Oh, I bet. You're a diplomat at the American Board of Oral and Maxillofacial Surgery. What % of dentists or surgeons do you think obtain their diplomat?
I would say probably 85 to 90%.
That's nice.
So the big issue is that to have hospital privileges, you have to be board certified.
Okay.
So you're kind of not necessarily forced to do it, but if you want to practice in a hospital and have hospital privileges, you have to. Now, the big problem is you have to do so many cases per year at a hospital to maintain privileges. Okay. So we get in this catch-22 when it comes to this, Howard, is that if you don't do, say, 10 cases a year, the hospital is going to take your privileges away. I don't know why, but they do. Now, to maintain your board certification, you have to have hospital privileges. So you have to be board certified to get hospital privileges, and then to keep your board certification, you have to have hospital privileges. So it's doesn't really make sense. Because
so you have to take 10 patients to the hospital each year just to maintain that?
Yeah.
And do they all need to go to the hospital, or
That's the problem, is that you sometimes get forced to maintain your hospital privileges taking patients to the hospital that could be done in an office setting which is driving up the cost of healthcare. So,
Yeah. And that was really the problem with Obamacare is, I don't like to talk about religion, sex, politics, violence, but I'm not talking about politics.
You can always talk about politics or religion if you know the person you're talking with already agrees with you.
Ha! Well, the thing...
Otherwise, you're right.
what I thought was Obamacare, it was a great heart and great passion, because I have 4 boys. I loved it when they could stay on my health insurance.
Yeah, until 26
older. Until 26, because my boys are 28, 26, 24, 20. That was great. I loved it when they got rid of pre-existing conditions.
That's the one thing that is off the table as far as I'm concerned with any new healthcare reform. Nobody with a pre-existing condition should be denied insurance or have to pay an exorbitant, premium because of it. And that, it's just, and when they start talking about healthcare reform this year, I was just infuriated because I'm a Republican. I typically vote party line, except for the last election. I voted for the governor from New Mexico or whatever it was, because
The Libertarian.
Yeah.
Yeah.
I could not bring myself to vote for our now president or his opponent. But, so I've been party line, almost my entire life. But when the Republicans started talking about messing around with this pre-existing condition thing and taking it, out of any kind of healthcare reform and letting the states try to create a pool for high-risk people, I'm just totally against that. If you have a pre-existing condition, and there's plenty of people that do, they need to be able to have affordable health care.
I just thought it was crazy that Obamacare, they had this Medicare system that every grandma and grandpa loves. And then they had this Medicaid system that's different in every single state and is anywhere from crazy to functional to dysfunctional. And Obamacare was to beef up the Medicaid system. And it's like, you had a perfect system, Medicare. Why didn't you just roll out Medicare? But I didn't want to go there. Yeah. But the point, I didn't want to get into politics at all. But the point I was saying is that when they do Obamacare, they always had great deals, no pre-existing conditions, kids stay on your insurance policy, but they never ever do anything for cost containment. Like in our business, I have 2 full-time employees that just shuffle paper to the insurance companies.
Well,
and here's another example where you got to take people to the hospital just to maintain your right to go to the hospital. Right. They never address crazy overhead and say, okay, here's 2 great things, but here's 2 things that will save so much money it'll pay for the great things. Yep. They never cut cost. They just always expand the overhead.
Well, the state association has been trying for the last 3 years to get the adult Medicare or Medicaid, whatever the right term is, dental benefit reinstated. And they cut that, when the state was having financial problems. That was one of the things they cut. But the number of emergency room visits of adult patients with dental emergencies skyrocketed.
To 8%.
And so...
Is that what the number you heard, 8%?
Yeah, no, I don't remember what the number was exactly. But the bottom line was that was costing the state a lot of money because of these emergency room visits. And the association showed that if they had the adult dental benefit reinstated, it would actually save the state money. So, they thought they were doing the right thing, cutting a cost, but as it turns out, it wasn't. And it was costing more because they're all going to the emergency room. And now I believe they've reinstated the adult.
Yeah, 8 out of 100 people. You walk into the emergency room, maybe you're having a baby, maybe you're having a heart attack, maybe you fell down and broke something. 8 out of 100 have a toothache, odontogenic origin.
Yeah.
And that's sad. And I also want to thank you. You have been CPR certifying me since
probably 98 or 99.
Yeah, I think the whole time, and my staff and my assistants and all that stuff. But out there, I'm thinking, who's listening to an oral surgeon right now? With all the podcasts available on Tukeetown, who would be listening to an oral surgeon? So I'm going to try to, my job is to try to guess what questions they have, but probably what questions they come in and ask more. And I guess the most basic is, why do wisdom teeth have to come out?
Well, what I always tell people when they ask me that question is, I don't have a crystal ball. Maybe they don't. So maybe they don't need to come out. But this is one thing I believe wholeheartedly, is that there's never going to be a benefit to having wisdom teeth. Doesn't mean that they're going to do you any harm, but there's never going to be an advantage to having them. And for most of the people that I see, they'll come in because they're having intermittent pain, or the orthodontist is sending them in because they say it's going to cause crowding to the teeth that have been straightened with orthodontics. And so probably my biggest population are the teens that have had braces and the wisdom teeth are coming in and pushing on the second molars. And the parents have paid thousands of dollars to have these teeth straightened, and they don't want to have to pay it again.
As in $5,000 or $6,000.
Yeah, exactly.
That's a chunk of change.
Yeah. But then,
and it doesn't make sense to. I know you have 3 daughters, but why would you want to ever put braces on your daughter to make her more attractive? Wouldn't you want to pull her front 4 teeth?
Yeah,
so she never gets a date and stays out of trouble and avoids all that.
A dad of 3 girls, exactly.
I think you should spend $5,000 to ugly your daughter up.
That's right.
Not make her more pretty.
Yeah, that's right. Yeah, you're exactly right.
You should shave your daughter's head and pull her front 4 teeth, not her back 4 wisdom teeth, and get her braces. But are there times when people come in where they don't need their wisdom teeth pulled?
It's interesting because I get asked that question all the time by parents as well. And so this year, it was in February, beginning of the year, was the first time that I saw a kid that I said, you know what? If you're diligent and you really work to maintain these teeth and keep them clean, I think you can keep them the rest of your life. So from my standpoint, to keep wisdom teeth, they need to come into the mouth. Okay. Not only do they need to come into the mouth, they need to come in straight, so they're in the line of occlusion they need to be, and they need to be completely accessible to clean. So there's a lot of people that come in, the wisdom teeth have made it into the mouth, but they're tilted in towards the tongue or out towards the cheek, and they just can't maintain them. They can't keep them clean long term. And this kid came in, and the gum tissue is right at the CEJ, at the back of his wisdom teeth. So you probably see a lot of people yourself that they have wisdom teeth come in, and if they're straight, that gum tissue's right up against the occlusal surface, and they can't maintain the back part of the tooth long term. And then I see all these adults that I'm taking out wisdom teeth, not all 4 at a time, but 1 here and 1 there, and it's because they get decay, and it's because they can't maintain them, they can't keep them clean. And to take out a wisdom tooth on someone that's 60 is 100 times harder than to take one out on someone who's 17 or 18.
Amen.
And they're more prone to complications. We just don't heal as well as we get older. So you have a lot more chance of osteomyelitis, dry sockets.
I remember these aren't dentists. You're talking to a dentist, but you're talking about
bone infection.
Bone infection.
And just delayed healing, pain, more pain.
I've been doing this 30 years. It seems like the people, you say, okay, you can keep your wisdom teeth if you really brush and floss them really, really well. Well, we know that people don't brush and floss really, really well. I mean, I've never told a patient in 30 years, I think you're brushing and flossing too much. So then they leave them in there, but the bigger problem is if they can't keep it brushed and clean, it turns into gum disease. And when I have patients that need to remove all their teeth and get dentures, it's more from gum disease, not a cavity in the tooth. Would you agree with that? What percent of people do you think that have dentures lost them from cavities versus lost them from gum disease?
Well, in my practice, it's about 50-50 actually. So, and then it's very common to see people that have a lot of decay and gum disease.
And what would that patient's average age be? To have a lot of cavities, a lot of gum disease, needing all their teeth removed for a denture?
I'm going to say right now what I'm seeing is probably 55 to 65. And 55.
Darn, I just turned 55 last week. You're telling me I'm just entering the zone of a
and
lot of cavities and
that
gum
may
disease?
seem young, and it's not a lot of people. So I think I'm seeing less people now that have to have their teeth removed for dentures than I did when I first started practicing, but I still see them. And
What percent has it gone down in your 25 years you've been an oral surgeon?
24 years, and I've been out here for 23.
So in your 24 years, you say the dentures have gone down. What percent?
I want to say probably 60%.
Wow, that's amazing.
Yeah. Now, part of it is the area that we're in as well.
Ahwatukee.
You know, this is a highly educated area, and people are very oral conscious as far as their oral health goes, and as far as their medical health goes.
But you've been in Ahwatukee 23 years.
Yeah.
But you're saying in the 23 years Ahwatukee since that'd be 1994 to 2017, you said it's gone down 60%.
Yeah, I'd say 60% from when I first started practicing.
You know, and that's but you don't think it'd be that way for the nation though.
No, and I think it's certainly going to be a lot higher in more rural areas, smaller towns that don't have as many dentists, and
What I'm reading from the CDC for the United States as a whole, that at age 64, 10% have zero teeth, and at 74, 20% have zero teeth. The last thing I saw, I think it was.
so that's 90% that have most of their teeth when they're 60, and 80% that have most of them when they're 70. Which is probably astronomically higher than it was back in the 20s, 30s, 40s, 50s, and
Oh
even
my
the
god!
60s.
Oh my god! Yeah, yeah.
Yeah.
Yeah, talking to older dentists that have celebrated my next door neighbor, Kenny Anderson, who inspired me to be a dentist, which he just celebrated his 50th year at his office. I just celebrated my 30th year. He just celebrated his 50th year. And we were talking about it. I mean, 50 years ago, he did a denture a week. Now he does a denture every 6 months.
Yeah.
So, you know, when I look at your dental career, I would say the biggest game change I've seen following you for 23 years, that oral surgeons used to mostly pull wisdom teeth back in the day. But now you're placing a lot of implants. And would you say you're doing more implants than 23 years ago as a percent of your practice?
Oh, sure. And I think everybody that's an oral surgeon or a periodontist for that matter is placing a lot more implants. So, you know, when I first started practicing, Howard, implants were just on the forefront in the United States.
They were controversial back then. Subperiosteals, blades,
Yeah,
frames.
I mean, there was a few fringe people that were doing the subperiosteal and the blades, but even those people that did them right had pretty good success rates, like Hilt Tatum. You know who Hilt Tatum is.
We just podcast interviewed him yesterday.
Oh, okay.
From France.
Yeah. So he used to be down in Florida. And,
St. Petersburg?
Actually, when I was in my residence training, he came there and did
Nice.
did an implant for us, a full arch lower, blade implant. Pretty interesting. And so the issue is there's a learning curve, and nobody could reproduce his results except him. And same with some of the subperiosteals, and same with just single dental implants. There is a learning curve, and the biggest thing. So most of the public that maybe hear this, they've heard of dental implants, and they think they're, hearing on the news are the greatest thing. You lose a tooth, you replace it with a single tooth. It's great. What disturbs me a little bit is that people aren't really being told everything about dental implants, and that is dental implants fail. And we didn't, back in the early 90s, even the late 90s, we thought if you put a dental implant in, it was in there for life. Well, as time's gone on, we put in more implants. We know they get gum disease around them, just like natural teeth, and they are not foolproof. So I always tell people when they come into my office and they're thinking about a dental implant, if they have a tooth that can maybe be saved with a root canal, but they've heard bad things about root canals, I said, hey, look, if I knew that an implant that I was going to put in was going to be 100% successful 100% of the time, I'd say take it out. But I don't know that, and I can't promise you that. So go to your root canal specialist and see what the prognosis is on this tooth, and if they can save it with a root canal, go that route. If the root canal fails sometime down the road, you don't have a choice. Then we have to do a dental implant. But that's a big perception about dental implants, is that they're in there for life. And I think most of them are, but I don't have the statistics, but there are complications. And the more continuing education courses I go to, the more it's all about complications.
But other implants, like getting an artificial hip or a knee, they're not permanent either.
Nope. And they fail too.
And and how long do you think a knee or a hip will last?
Well, I have a knee. So
you have an artificial knee?
Yep. And mine was placed in 2006. At the time, they told me 10 to 15 years. So, and I'm past the 10-year point.
And those hips, I mean, in my 30 years here, I can't tell you how many of my patients went in for a standard hip replacement, got a staph infection, and it went south very, very bad.
Wow, that's a lot.
Yeah. So, I mean, so they're not cures, and you're still going to have to take care of them like natural teeth.
Yeah.
And one of the problems with implants is that, well, if you don't brush and floss your natural teeth, and then it gets a cavity and gets a root canal and gets right to an implant, well, if you still don't, if you didn't change your behavior, it's kind of like I saw one study that showed one group got the quadruple bypass, and they looked at their survival rate. Then the other group didn't have insurance, couldn't get the quadruple bypass, but the ones who left, who lost their weight, quit smoking, and started exercising, actually lived longer than the group who got the bypass. And so the bypass isn't going to fix your obesity, your diabetes, your lack of exercise, smoking, drinking, and doing everything else.
And I would guess that if you've been a lifelong person who doesn't floss regularly and doesn't go to the dentist every 6 months to make sure things are good, just like people that have had a major health scare, is that you may change your habits for a little bit, but gradually, if you've spent your life not brushing and flossing, you're going to regress back to that. And I saw this with my own father after he had a heart attack and bypass surgery. His diet was impeccable, for about 3 years. Gradually went back to his old habits. And I think that's just human nature.
My problem is I grew up and I was combing my hair, then floss. And then my hair fell out. I didn't, my routine broke, so I quit flossing. I want to, you said, so you may want to save the tooth, just don't think it's a cure-all to pull the tooth and do an implant,
right,
and send them to a root canal specialist. How many root canal specialists does Ahwatukee have?
Ahwatukee has one.
My gosh, we need to get him on here next. We'll do a whole category. We'll cover all the endodontists with one interview, all the oral surgeons with you. That's great.
Yeah.
What is his name?
Richard Ream. You
Rich.
probably know.
Oh, I know.
Rich,
Richard
yeah.
Ream,
Yeah.
And is he a Creighton boy too? He's from Nebraska, isn't he?
I don't know. He's not a Creighton guy.
He's not a Creighton guy?
No. I don't know.
Well, send him over here.
Okay.
That would be great. This is but when you said you got to brush and floss and all that kind of stuff, they're reading their own Arizona Republic that's showing newspaper articles that there's no research that shows floss does anything. So you're saying to brush and floss, and our own Arizona Republic is saying there's no research that shows floss works. What would you say to that?
Floss your teeth after eating corn. Brush your teeth first. Sit back. Brush your teeth first. Okay. And then when you're done brushing, then floss and see what comes out from between your teeth. And that's the stuff that you're not getting when you brush. And it's gross. I mean, some of the stuff you pull out of your teeth, chunks of chicken.
It flies on the mirror.
Yeah.
Have you ever flossed and it
Yeah.
flew on the mirror?
Yeah.
Yeah,
So-
then take a picture of your mirror and then send that to the Arizona Republic.
Yeah,
And,
and all that, and you know, we both know if that sits in there, that's going to cause inflammation, gum disease, decay. So,
Yeah, I say you can read the Arizona Republic or you can listen to a dentist and oral surgeon. I always tell my patients when they ask me that, they say, but the newspaper said there's no research. I said, you know what? You only have to floss the teeth you want to keep.
there's something called common sense as
And
well.
it's not very common.
Yeah, well, and that's why the media. Well, we don't want to get onto the media, but they're basically not reporting things. They're trying to make news instead of reporting news.
You know, this is called Ahwatukee Uncensored, so I don't want to talk about something everybody already knows. So I want to get to the most controversial part of what you do, and that is IV sedation. People see articles in the news where, you know, their 2-year-old daughter went and was put down to have some pulpotomies and chromosome crowns and didn't recover from the anesthesia. And some people, and you're in a tough spot because about half of America is afraid to go to the dentist. The other half of America is afraid of the dental bill, you know.
Yeah.
And so what would you say to her? She says, you know, I'm afraid, and I need to go in there and do this. I want to have IV sedation, but I don't want to die in a dental office. Do you ever hear those concerns? Or
Oh, yes.
Have you seen the newspaper article?
Oh yeah,
Doesn't it seem like
it is a hot topic now in dentistry with the deaths that we have seen, mostly in children that have gone in to have work done, but there have been adults as well. And it's a very hot topic in my specialty, and the state boards are implementing stricter regulations, especially out in California. The bottom line is that our profession has showed statistically that it is safer to have anesthesia delivered in an oral surgery office by a board-certified oral surgeon than it is in a hospital. Now,
I wish you'd email me that. I would love to. I would love
Yeah.
to read that.
And
If you remember that, email that to me.
And I'll actually give you the link because they had this on, it was 2020, but Sunday night with Megyn Kelly, I think,
Yeah.
where they had these deaths.
She used to be on Fox News, and now
Yeah,
she's
and,
where's she
there
at
was,
now?
and they actually had someone from our specialty on there that addressed that, and probably you can get the statistics off of that. But the bottom line is anesthesia is a risk, whether you're going to have it in an oral surgery office or in the hospital. And the worst complication from anesthesia is death, and it can happen. You know, it can happen in anyone's office at any time, and that's just one of the risks that you need to know about. And I don't want to say be willing to take that risk because it's very rare that it happens. An oral surgery office, I don't know what the statistic is right now, but it used to be every oral surgeon, one in a million cases, they would have a death. Okay, so I'm never going to do 1 million cases. I'm never going to get close to that in my career. But that was the statistic. Now, it's
Have
an
you had a
issue.
death?
No.
How many cases have you had? Are you
many
at
cases
are you
have
at
I
500,000? How far are you along that
No,
million?
let's just say I do 1,000 sedations a year. That's only 24,000 that I would have done, and I probably don't do 1,000. I'm guessing.
Is this true or false? Some people say that most IV sedation deaths are humans, children 13 and under, or adults 65 and over. That between 13 and 65, which you're basically pulling wisdom teeth on the most healthiest person,
Yeah.
18 to 21. But do you agree that most complications are 13 and under and 65 and over in IV sedation?
I don't know the statistics on that, Howard, but this is what I'd say is that population is physiologically more fragile than 13 to 65. And that's the biggest problem. So there's two things with IV sedation. And number one, children, you have to know their weight, okay? So there's been a lot of deaths in the past that are actually due to local anesthetic overdoses versus the IV sedation itself.
We had a general dentist do that in Phoenix a few years ago, right?
Yeah.
And it was too much anesthesia.
Yeah, so we can only give so much local anesthetic per body weight, and every dentist should know exactly what that calculation is. You know, if it's 2% lidocaine that we're using for what people call Novocaine.
Was that case because the hygienist numbed up the child and the doctor didn't know it, then the doctor came up and numbed the child up again?
I didn't hear that. So the only thing I really know is that they had a toxic level of local anesthetic. And this is one of the problems with kids. Okay. Kids have a more difficult time discerning pressure from pain. And especially, if they're in that 6, 5, 4, and they're awake, you give them a shot, they may be numb, but if you push on them, they're feeling pressure, but they think it's pain. Or it could be pain. They just don't communicate as well as adults do. And even some adults you probably had, they're numb, but you touch them and they're scared. And so, number one, local anesthetic is the biggest thing that every dentist should know. They should know the toxic doses per kilogram, and they should know that like the back of their hand. And I don't want to get a bunch of general dentists mad at me, but I bet if we were around the area, they couldn't do that.
How many of them don't even have a scale?
Yeah.
How many on the way just say, Mom, what does Megan weigh?
Yeah.
And she has 25. Well, Mom's not delivering the anesthesia. Do you think Megan should stand on a scale?
If you're going to be doing local anesthesia on someone that's young, yes. Someone that's less than 100 pounds, you need to know.
So you're saying I would have to go? I'm 99.
Yeah.
I wrestled 98 freshman year of high school. I think I'm still at that weight. I haven't been on a scale, but I did wrestle varsity 98.
So that's one thing as far as the deaths go, is local anesthesia. But there are just complications that arise that even with young, healthy adults that cannot be foreseen. And then you have to have a team that is ready and prepared to handle that emergency. And, the state board comes through all the oral surgery offices and certifies us, runs us through emergency protocol, and makes sure that we're delivering safe anesthesia. So, but all that being said, you can have an emergency, and you have to be able to react to that emergency. And I just had a patient this summer little girl that needed some teeth out, and the parents rightfully, were very, very concerned about anesthesia. Because
How old was the little girl?
8. And they were concerned simply because they've seen everything on the news. And it was after this Megyn Kelly thing too. I think it was Megyn Kelly, was it?
I don't know, I didn't see that. So this 8-year-old girl needed some teeth out, and her parents were concerned.
And the parents were concerned, and rightfully so. I mean, you should be concerned too. I'm concerned if my kids are going in to have, any kind of procedure. Thankfully, they're healthy and they haven't. But I'm not so concerned about the procedure based on my background and my knowledge. I'm concerned about the anesthesia and who's delivering the anesthesia. So, in my office, I've had a board-certified anesthesiologist in there since 2002. And I'm not going to say that every oral surgeon should do that, but what I would say is, for me personally, when I'm doing a difficult surgical procedure or just wisdom teeth, some cases are easier than others, but I am totally focused on taking those teeth out. If I'm doing the sedation and taking the teeth out, I have to be thinking about two things. So for me, it's a lot less stressful only thinking about one thing, and that's taking the teeth out.
But isn't that the standard of care in all hospitals? I mean, in a hospital.
Well, in a hospital, yeah. But we're talking about different types of
but,
procedures.
But But in a hospital, I can't do your bypass or fix a broken leg orthopedic surgeon or remove a brain tumor and do my sedation. That's not allowed in any hospital in America.
No, but they look at taking out teeth as a much minor procedure.
But it doesn't matter what the procedure is because it's the anesthesia.
You still have the risk.
Yeah, so if I put you to sleep, I mean, look at Michael Jackson. He was put to sleep on Propanol. He wasn't having any surgery, and he didn't wake up. So it's the anesthesia. Michael Jackson didn't have. But didn't you think that was strange that his doctor was putting him to sleep with Propanol?
Yeah, propofol.
How do you say
Propofol.
Propofol. So PROPOFOL.
Yeah.
Propofol.
Yeah, I mean, that's just one of those rich Hollywood people that can pay someone to do what they want. And he had a lot of other stuff in his system as well.
He did? What else did he have?
I don't know. If you look it up, he had more than just propofol.
Oh, really?
Yeah.
I thought that was... But speaking of propofol, that's a very good topic. A lot of people ask, has IV sedation, what you use, changed from 23 years ago? Or is it the same pharmaceutical cocktail? Are you putting people to sleep the same way now as you did 23 years ago?
Mine is pretty much the same. So I've always done a deep sedation or a twilight sedation. So
you have two
levels.
But actually, don't you also have a lighter level, like laughing gas?
Yeah, and I don't really consider that a sedation. I'll just call that an anxiolytic. Something to relax them.
So what would you come? So if someone's so you're talking about
it's a conscious sedation. So there's the proper term.
So if they're out there, would it be fair to say, or is your fear mild, medium, or strong, and then mild laughing gas, nitrous oxide, medium, twilight, conscious sedation, and then high.
Deep sedation or general anesthesia.
Is that basically how you break it up into the three?
Yeah, but so. Then you have to actually put in the difficulty of the procedure, not just their anxieties, but how difficult the procedure is going to be.
Well, if they're married and they have 3 or 4 kids, they don't even need anesthesia, do they?
Yeah.
We're so used to pain and suffering.
That's right.
You could pull my wisdom teeth with no anesthesia after raising 4 boys.
In my office, anyhow, is I will give people an option. I'll say, you can do this awake if you want, or you can be asleep. Or, if you don't want to be asleep, you can be lightly sedated. Okay. This is what's really interesting about that, is that there is a percentage of people that want to have their wisdom teeth taken out awake. Okay. And for whatever reason, I don't know the reason, but they say, no, I want to be awake. Even if they're difficult teeth, they have 0 problems during the procedure. Now, there's a smaller percentage of people that want to be sedated, but do it awake. And even if it's just 1 tooth, not even a wisdom tooth, an easy tooth, they have a terrible time. Okay? That tells me more than anything, it's a state of mind.
Sure, absolutely.
And if I take a 6-year-old from one of the lower socioeconomic classes in Phoenix, bring him to my office, I can give him local anesthesia and he won't make a sound. I bring in a 6-year-old from Ahwatukee, they need to be asleep. So
man, you are completely uncensored. And it's so true.
But it's about expectations. And the expectation is going to vary with the country you're from, the region of the country you're from. Good buddy of mine is an oral surgeon down in Mexico City. They do their jaw surgery with twilight sedation. So they're not even asleep when they're having their jaw broken and moved forwards or backwards. They hardly ever do a general anesthesia down there in a dental office. They hardly ever do twilight sedations. But that's the expectation of that country. Our expectation is if you're going to have wisdom teeth out, you're going to sleep. Now, I can tell you this. Were you awake or asleep when you had your wisdom teeth out?
Oh my God, I was at Creighton. So I went to the dental school.
Yeah.
And they were fighting over me for their requirements. And the guy that pulled my 4 wisdom teeth. I don't think he'd ever pull one. It was 4 different 1-hour appointments with local.
So one at a time.
And one at a time, an hour. How long would it take you to pull up my 4 wisdom teeth?
Well, at 55 or...
No, back when I was 17.
You know, if you were sedated,
Yeah.
I always tell my patients it's 45 minutes to an hour for 4 teeth.
Yeah. And that was 4 1-hour appointments.
Yeah.
And I think on the first 3, the instructor had to come in and finish it.
Yeah. Well, and the point I was going to make is I had mine done at Creighton too when I was a dental student. And I was awake. And it was not the end of the world, but it wasn't a pleasant experience either. So I think it's got to be nicer for the patient to be sedated, but it's not absolutely necessary in all cases. So some people can do it awake.
But everything, all of our strengths and weaknesses live between our ears. Because when I take my boys and we do missionary dentistry in Chiapas, where they just had the 8 earthquake, and down in Osteonecrosis, which is north of Acapulco, I've never seen anyone there ever flinch during a shot.
Yeah,
They're the most stoic. Boom. I mean, they don't even blink. And then when I get poor kids from Guadalupe, poor kids from South Phoenix, I don't know what it is. They're just like the mom says, "You be good," and he's boom.
Yeah.
And then you get Muffy with a helicopter parent flying around it, making sure it never trips or falls down, and handing it everything it needs, and it's can get crazy.
That's my experience exactly, and it's expectations.
So what percent of Ahwatukee did we just piss off? Would you say all of them or all of them plus 10%?
Well,
And here's another thing I
Well-
see. They come in and they're sleeved from 1,000 tattoo injections.
What's better-
He's sleeved, he's on roids, he's all buff. And then I go to give him this little itty bitty shot. You're like, get. And I'm like, how many shots did you, so it shows you it's all in your head.
It's all, and not only the different artwork they have on their body, what really gets me is when they come in with a tongue ring. And I know that
No anesthesia.
there's no anesthesia when they get that, but when I go to give a shot, they're moving all over the chair.
Yeah, so happiness is an inside job. Something else is they were getting married the night before disasters. Happiness inside job, fear is an inside job. But one thing on that tongue ring, I've noticed watching tongue rings for 30 years that plastic ones okay, but when they get those metal ones, they break teeth. Do you agree or disagree?
Yeah, and it also causes recession on the back part of the lower teeth. So you've probably seen this too, where most people get gingival recession on the front side of their teeth, but from a buildup of plaque, not taking care of their teeth. But those tongue rings can really cause havoc on the back side of the lower teeth.
So maybe I don't know if she wants to know or not, but what's the difference in drugs between? They know what laughing gas is.
Yeah.
Nitrous oxide.
Yeah.
But what are the difference in drugs between a twilight sleep and a deep sedation?
Well,
or is it just the amount of the drug that you
it's mostly the amount of the drug and propofol.
So what Michael Jackson had was the deep sedation.
That was the deep.
And then Propanol plus what for the deep?
So when I do my Twilight sedations, there's an anxiolytic, Versed. There's a narcotic for pain, fentanyl. There's an anti-nausea one put in there, Phenergan or Zofran. And depending on how much of that you give them...
Is Versed kind of like a Valium?
Yeah.
So Versed, which is kind of like
shorter acting than Valium.
Fentanyl, which would be, you call that a narcotic.
Yeah.
And then Phenergan, which would be an anti-emetic,
Yeah.
anti-nausea. Okay.
Yeah. So they're going to get those, and then depending on how much you give them, will determine how sedated they are.
Okay.
Now, when my anesthesiologist is in there, he uses those drugs plus the propofol. So my combination of drugs, people will sometimes fall asleep just because they're relaxed, not because they're forced to go to sleep. When you give them the propofol, they're forced to go to sleep. You can't fight that. You can fight the effects of the other ones, but you can't fight the propofol. It's a general anesthetic.
Why do you still always tell them they can't eat 4 hours before?
6 hours.
It's gone up to 6.
Yeah.
My gosh.
It can be 4 for children because their stomach empties faster than adults.
So what if they wake up, their appointment's at 1? Can they have a cup of coffee like I'm having now? Can they, and talk about why can't eat? And then in your 24 years, has anybody didn't want to make their appointment but didn't want to tell you that they stopped by McDonald's and had an Egg McMuffin and a hash brown on the way to your office?
Well, no. In 24 years, no one has thrown up. Doesn't mean that they maybe didn't do that and have something to eat within that 6 hour time frame, but no one's thrown up to our suspected that they did.
Is that why you're adding the Phenergan, the anti-nausea?
No, that's more for afterwards because just the Versed and the fentanyl can sometimes make people nauseous, and then people swallow blood, which makes them nauseous as well. And when they take their pain medicine for afterwards, that can make them nauseous. So putting that in the IV, is going to help minimize any nausea related to the other medications or from swallowing some blood.
But again, she's listening to just basic. Why can't I eat 6 hours before?
Yeah. Well, it's
Is
not
it just because you're a mean guy.
It's not to torture you. Okay. So when you're sedated, if you have something in your stomach and you get sick to your stomach and you throw up, it can get into your lungs. And what I always tell people is think about when you're drinking something and we say it goes down the wrong pipe. Well, it's getting down between the vocal cords. And our body doesn't want anything past our vocal cords except air. Okay? So when we start coughing violently like that, that's a protective mechanism that's preventing any water or food getting into our vocal cords.
So it has two functions. It's to vocal cords to speak and to keep food and liquid going into her lungs.
Yeah. And it's a protective mechanism. So when we're awake, we can break that spasm. That is a muscle spasm where those vocal cords are snapping shut. But when we're totally awake and conscious, we can break that. When we're sedated, if they snap shut like that, we may not be able to break that spasm ourselves. And then your lungs are shut off from getting oxygen. And that's a life-threatening emergency that has to be dealt with immediately. So that's the biggest concern in doing anesthesia, I would say, in an oral surgery or dental office is what we call a laryngospasm, which is the vocal cords snapping shut because something got down there on the vocal cords and our body is reacting by just snapping shut.
Is that what happened to Joan Rivers?
I don't know for sure if that's what happened to her, but because she was having surgery on her vocal cords, wasn't she? Mm-hmm. So I don't know what kind of anesthesia they would have been doing for her, to be honest with you.
But another type of sedation is booze and drugs.
Yeah.
Isn't that how Janis Joplin and Jimi Hendrix and the original lead singer at AC/DC, isn't that what happened to them, where they drank so much booze, passed out, then they vomited, and it went down into their lungs?
It could have been. I haven't read that. If you know that to be, if that's what they said, then that's probably it. But that's why we don't let people have anything to eat or drink, including water, for 6 hours, is because if they do get sick and throw up, then if it gets onto their vocal cords, you can be in a life-threatening, emergency.
So you want an empty stomach.
Want an empty stomach.
So now this is Ahwatukee Uncensored. So now we're going to talk about something very controversial. Opioids. There has been articles calling oral surgeons out by name that 50,000 Americans die from overdose, and there's a lot of people saying that if you walk into an emergency room and you tell them you have a toothache, for 30 years they just give you penicillin and Vicodin. And so what is your thoughts about opioids, and has it changed from 24 years ago to now? Like if you're going to pull my 4 wisdom teeth, I'm going to go home and I'm from Ahwatukee. If I'm from Mexico, but if I'm from Ahwatukee, I don't want to go home and suffer for 2 or 3 days. And they, so what's your views on this big? I mean, you've read about all the opioid.
Yeah, and I think it is a huge problem. Okay, but so as far as my prescribing practices go, they have not changed. Okay, what I'm actually am going to do in my office is to actually find out for what I typically prescribe how much of that is getting used. Okay, so it's really hard to predict someone's tolerance to pain as far as writing for narcotics for post-operative pain. There are some people that I'll do very difficult teeth on, and they'll come back and they'll say, I only took 2 pain pills. And I'll have people that I consider a much easier case that are out in 3 days. And basically I have about a 3.5 day supply that I prescribe.
A supply of what? What do you actually...
If it's wisdom teeth, it's Percocet.
Percocet?
Yeah.
And what's the difference between Percocet and Percodan?
Well, Percocet has Tylenol in it, and Percodan has aspirin.
Okay. So if you pull wisdom teeth, you give a 3-day supply of Percocet?
Yeah. 20. I typically prescribe 20 tablets, and they're to be taken every 4 to 6 hours. So if you take one every 4 hours, you're using 6 in a day.
And why did you like... So Percocet is oxycodone?
Oxycodone and Tylenol.
Acetaminophen. Why did you pick oxycodone and Tylenol acetaminophen instead of Percodan, oxycodone with aspirin? Why did you like it with Tylenol instead of with aspirin? What was your thinking there?
No real... I'm not even sure if they do Percodan anymore. I'm not even sure if they make that.
Huh.
To be honest with you.
But you said that's your standard protocol for just routine wisdom tooth removal?
Some people would use... Yeah. So some people would say that the Percodan, the aspirin may cause bleeding. That was never really a forethought of mine, though.
Didn't that come out of the marketing department of Tylenol?
Probably, yeah. Yeah, exactly.
Yeah, I'm pretty sure that came from the marketing department of Johnson & Johnson.
Like I say, what's interesting is that some of those people that I have difficult cases will come back and say they took, 2-3 pills. A very small amount from what I would expect based on the difficulty of the surgery. Now, other people, pretty easy. They take them all, and sometimes they have to give a refill. Now, what almost every governor in the United States has done as declared a proclamation that this is an epidemic because of all these narcotic overdose related deaths, and they have changed the laws. So as it stands now, we cannot prescribe more than a 7-day course, and it might be 5 days in Arizona. Some states are 5 days, others are 7 days, where you cannot prescribe any more for that period of time. Okay, that's all they can get. If they come back, of course, and they're in pain, you can justify that based on the procedure you did if they need more. So now in Arizona, though, starting, I'll have to look it up. I don't know if it's the middle of September or middle of October, that before prescribing any class 2, 3, or 4 narcotics, we have to go to the Phoenix Board of Pharmacy. They have a website where you can find out someone's drug history as far as prescriptions for 2, 3, and 4s. So, and you have to document that in your chart, that you went to their website and you looked at this.
You have to do that now?
It's either starting this month or next month. So you have to be
before
registered.
You write a narcotic, you have to see their past use?
For the last 12 months.
What do you think about that? What's your thoughts on that?
The question I have is, what if I see they've been getting a lot of narcotics from different providers or whatever, but I'm taking out 4 wisdom teeth? Does that mean I can't give them narcotics? I still need to treat the pain that my procedure is going to cause. So I don't really know. I think it has value when you have a new patient that is complaining of a pain that that's a vague pain that you can't really diagnose or find a cause for it, and they're saying that the only thing that works for them is Vicodin. That's a red flag right there anyhow.
When they know their drug by name.
Yeah.
Yeah.
Or they can't take Tylenol with codeine because it upsets their stomach. That's a red flag. I think there's value in those kind of cases to go and look and say, you can come back and say, hey, look, I looked at your drug history. I don't see an abscessed tooth here. I don't see an infection. I don't see a huge cavity. I can't prescribe you a narcotic based on what I'm finding clinically. So there's some value to it there. But right now, that's the only value that I'm seeing. Because, like I say, even if they had a whole list of narcotics in the past year, but I'm taking out 4 wisdom teeth, I still have to manage that pain. And if you remember, we'll say 10 years ago, I could be a little bit off, physicians were getting killed by not managing pain adequately.
Right, I know. When we got out of school, the media is beating us up because poor grandma's dying of cancer. She's going to die anyway. She's in pain. The mean doctors won't give her any pain pills. You pulled the wisdom teeth. We were the bad guy.
Yeah.
So we opened up the prescription, started writing out Vicodin, Percocet, Percodan, and now the pendulum 30 years later is like, and now we're the bad guy. So that's probably, it's that old saying, 2 steps forward, 1 step back.
Yeah. So it's, without a doubt, it's an issue. And the other thing that I think patients need to realize is pain medicine is not to eliminate pain, it is to help you manage it. So taking a pain pill shouldn't necessarily take away all the pain, but it should help you manage that pain and still be functional.
There's a lot of research out showing that alternating Tylenol and aspirin every 4 hours actually reduces pain better than opioids.
Well, I'm not familiar with that, but I am familiar with an article, and I can't give you the author, but if you take 3 Advil, ibuprofen or Motrin, all the same, that are 200 milligrams, with 1 extra strength Tylenol at the same time, that is equivalent in strength to a Vicodin or a hydrocodone.
3 Advil and 1 Tylenol.
An extra strength Tylenol.
An extra strength Tylenol. That's another question patients always ask. On their prescription, if they do substitution permitted, they get it cheaper versus brand name. If she's at Walgreens and she sees the Advil and the Tylenol and they're $6, then they see the Walgreens or the generic and it's half the price. Is that the same stuff in your opinion, or is it worth paying money for the brand?
Well, according to the FDA, it should be the same.
So do you sign substitution permitted
Yeah.
or dispense?
I do, because some patients want that. They'll take the cheaper alternative. And it should be just as effective.
Yeah.
When I go in to buy Advil, I buy brand name Advil.
You do?
I do.
And why do you do that?
I don't know. I just do. Habit, whatever. But
Habit or trust?
I get...
So besides removing wisdom teeth and removing any or all teeth or placing implants, is there any other procedures you do?
Well, we do a lot of biopsies. And there's certain things that I do not do. That may be a better question. So...
Well, you promised me an hour on your weekend. It's exactly 1 hour. Do
Okay.
you need to run? I know you needed to go.
No.
Can we go to some overtime?
Yeah, and if you want to edit things out...
No.
go ahead and edit.
I don't want to edit anything out. I have no edits yet. I just want Ryan to edit out my bald head and my fat belly. I'm trying to hide my belly behind the table. Am I doing a good job, Ryan? No, my question is, this is Dentistry Uncensored. This is Ahwatukee Uncensored, and I'm a dentist, you're an oral surgeon. When I got out of school in 87, 30 years ago, oral cancer was all about smoking and drinking. And it was almost kind of judgmental. It's like, well, you smoked a pack a day for 40 years, you drank a 6-pack every day. Those were the ones getting oral cancer. It was always grandpa, and you could always tell. I mean, there was a type of person. He was a good old jolly, he was you know who he was.
Yeah.
But now, oral cancer, you're talking about biopsies. Oral cancer has changed now. We have this HPV. There's vaccines for HPV, Gardasil, but you need to get in there before they're age 12. Talk about oral cancer. Have you seen a change in oral cancer from 24 years ago when you got to Ahwatukee to 2017?
I'll talk about that. Don't let me forget to talk about osteonecrosis
Okay.
with the bisphosphonates.
Right.
I think that I have actually, in my practice, seen less malignant cancer in the last 10 years than I probably did the previous 10 years. But I don't see that much, Howard.
So malignant cancer has gone down. Now, when you say malignant cancer, is that the squamous cell?
Yeah, squamous cell carcinoma is what we're going to typically see.
And what would you call the HPV oral cancer? What would you call that?
It's not a squamous cell, and I'm not really sure what you call that.
But are you seeing any HPV oral cancer in your office?
No, I have not.
So you've seen the mouth cancer, oral cancer, mouth. It's funny, we Americans call it oral cancer, but the Europeans call it mouth cancer. Which one of those names do you prefer? Oral cancer or mouth cancer?
Repeat that, because I was thinking of something while you were
Oh,
talking.
no, go. Well,
So something you'll probably want to edit this out, because this
No,
is
no,
more
no,
of a
no.
question I have for you, Howard.
yeah.
So with the HPV related cancers, and this is a question that I haven't had answered directly by people that I've addressed it to. So if I take out a papilloma, and papillomas are, once I had it come back, or I shouldn't say that, multiple times if I take out a papilloma, it'll say consistent with HPV. Okay, but we know with an HPV there's multiple subtypes, and I think it's 14 and 16 that are related to oral cancer. So my question is, if someone's in the lab looking at my papilloma and they say it's consistent with HPV, why aren't they routinely subtyping it to see if it is a 14 or a 16? And the other question I have, and it's rhetorical, is, well, maybe it's not rhetorical. You may actually know the answer to this. Is the cancer that these people, and this is the question I haven't been able to have answered, is the oral cancer arising out of the papilloma that's consistent with HPV, or is it mean they're predisposed to other types of oral cancer? I don't know that. Do you?
I don't know that. When you get a positive biopsy for oral cancer, no, I was asking you, in America we call it oral cancer, but in the United Kingdom they call it mouth cancer. But when someone does test positive to oral cancer, mouth cancer, do you do that surgery yourself, or
No.
who's
No.
the go-to person for removal of oral cancer?
Well, now I can plug a couple of people.
Nice.
So, when I first started, really the only guy who did a lot of that kind of surgery was Glenn Rothman. You can look up his credentials and make sure that for the viewers you have it right. But now there's another guy that I trained with that's out at Banner MD Anderson out in Gilbert, Tom Schellenberger. Glenn was the only one doing these surgeries where you're cutting out part of the jaw, moving muscle flaps up to reconstruct them. So anyhow, basically, I think most of the oral surgeons, except maybe Reed Day, is not going to do their own definitive cancer surgery. We're going to do the biopsy, and once we have a positive diagnosis for squamous cell, then we're going to refer it to one of these guys.
Yeah. So, what would you do? What would you say to mom out there and dad if they have children under 12 that are talking about this Gardasil vaccine for HPV? Like some countries, like Australia, it's mandatory. If you don't give your kid the HPV vaccine, they ask you to leave Australia. And the governor of Texas tried to do that, and the backlash was horrendous. What do you think about? You have 3 daughters. Because you have to have it under 12
Yeah.
You know, by the time I really learned all about that, my baby's 22.
Yeah.
But what would you? Your baby is what is your baby? 14. So your
14.
baby's already past it. But what do you?
Yeah.
If you had your 3 girls tomorrow, would you give them the HPV vaccine?
I would talk to the pediatrician and find out the potential side effects of it first, but my gut inclination is, without really knowing much about the side effects, is I would give it to them.
Yeah.
I mean,
I wouldn't admit it.
Yeah.
In a minute.
yeah, unless the pediatrician gave me some compelling reasons not to.
It's kind of so funny because, you know, a lot of times people are thinking the sky's falling, the times are bad, and I just remind them, I mean, come on. I mean, America, when it had a civil war where almost 1 million people were killed, at a time we only had 30 million people. And then we went to World War One, and then after World War One, we went into full depression where we had 25% unemployment for 4 years. Then went into World War Two. So, you know, no matter how bad you think today is, it's not as bad as it used to be. And back to all these anti-vaccination people, I just want to remind them that this is 2017. Well, go back 100 years. The first 17 years of the last century, America had this little thing called the Spanish influenza, where 1 in every 20 people dropped dead. And now you're against vaccines, and if you looked at humans as a herd, no different than cattle and sheep and chickens and pigs, vaccines, sewage, taking your sewage out of your house and bringing clean water in, those 3 things did more than all the fancy root canals, fillings, and crowns and getting your wisdom teeth pulled for herd control. Would you agree with that?
Yeah, and part of it, you know, you're more in tune with this than anyone because, you know, you're the guy who pushed for fluoridation of water, and people are against that, and without any good reason to be against it, except it was something new, something that they were not afraid of, but it was something that was new. I saw a good movie, and you can edit this part out too. So, and it comes to that point, though, Howard, is, you ever seen the movie The Accountant?
No, but I heard about that. Is it Brad Pitt or Matt Damon or
Yeah.
Ben Affleck? Yeah.
So in the movie, he's autistic, and when he's growing up, his dad says, I have to think how he words it. He goes, he says, it's not that they hate you or not that they don't like you, and it's not that they like you. It's that you're different. And sooner or later, things that are different scare people.
You know,
which I thought was a great quote out of that movie. Have you seen it, Ryan?
Yeah.
Oh, yeah.
Do you remember that quote where he said that?
Oh, yeah.
Yeah, he goes, it's not that they like you, it's not that they dislike you, it's that you're different.
Yeah.
And sooner or later, difference scares people.
Right.
You know what? The current media right now really reminds me of when we first put fluoride in the water in 1989. I just want to, we're at hour 9, we'll wrap this up, but I just want to finish
Well,
with
you
this
can cut
story.
a lot of stuff out.
No, this has been awesome. But so basically, you know, there's about 100 elements on the periodic table. I think there's 92 that are found on Earth. And so the universe is almost all hydrogen, and when it clumps up together and gets so heavy, it forms a ball, and the gravity gets so intense that it pushes 2 hydrogen into helium, and that's the sun. And then when all the hydrogen turns into helium, it's double heavy, and then it runs out of fuel, and it collapses and explodes. And there's all your other elements like carbon, hydrogen, oxygen, silver, plate, everything. So fluoride is a natural element. And it's the 13th most common element of the Earth's crust, and it shows up in the ocean at 1.4 part per million. And when you put it in the water supply at just half that amount, the tooth decay plummets. And everyone knows that at the CDC, the American Dental Association, there's been 40,000, if you go to PubMed and pipe in water fluoridation, there's like 40,000 studies. And when we tried to put that in the water at 89, they gave it for 20 years. So when it expired, we had to go back and do the whole dog and pony show again. About 25% of Americans, they think it's a communist plot, it's crazy. They say things like, well, fluoride is so toxic that it's a byproduct of the mining industry, and it's so toxic, there's nowhere they can put it. So they bribe government officials to slowly pour it in our water because there's no other place they can put it. I'm like, well, why don't they put it where they've detonated 1,800 nuclear bombs in America?
Yeah.
Don't you think you could put it there? I mean, you detonated a nuclear bomb. I imagine you could pour some fluoride on it. But what I learned about that is, I don't want to make fun of people, but there's a lot of distrust. Like I say, well, the Centers for Disease Control, they go, well, that's puppets for the pharmaceutical industry. Anything, you give them any research, you say, well, this is a university research. Oh, they're paid shills for the pharmaceutical industry. So there's a lot of distrust, but I would just say this. I think, I gave it to my kids, it's just an element. And then they say, oh, no, it's not an element. It's a sodium fluoride. It's a nanofluoride. Dude, if there's a fluoride ion in the water, there's not one scientist at NASA could tell you where it came from. It's an ion. But do you want to say something?
Well, when I was a kid, we had fluoride drops.
That's what my mom gave me.
Yeah.
But I got to tell you that the America was one who invented water fluoridation. It was January 25th, 1945, Grand Rapids, Michigan. And I love to tell the story because the guy, the smartest dentist that ever lived was that dentist because he knew the backlash. So they talked about it. They told the city they were it was an experiment. I mean, how would that be the first city to pour, a medication?
Right.
It's like a medication. It's like it's an element. And by the way, what's so funny is if you were really, like we are, doctors trying to be objective, if you had a beef with something that a city adds in the water, you have a mountain of research with the chlorine. You don't have squat on the fluoride. And is the chlorine controversial? Oh, hell no.
No.
It's the fluoride. It's the fluorine, which is. But anyway, so they started Monday morning, 8 o'clock. Oh my God, emergency rooms, anaphylactic shock, fainting, dizzy, and the mayor's getting mad, and the mayor's calling the water department, and they're not taking any calls. And the day two, it's evening news. The whole town's upside down. Finally, the governor and the mayor demand that this dentist addresses the media. And he walks out there, and guess what he said?
What?
Oh, I haven't turned it on yet. I knew this was going to happen. Everyone who fainted and went to the emergency room, sorry, we haven't turned it on. We knew this would happen. We're going to turn it on next Monday. Is that the most brilliant move ever?
That is.
I mean, that was just the most brilliant move ever. I like, God, that should be a Hollywood blockbuster. I mean,
that's good. I haven't heard that story.
Oh yeah, man, that's a legend story. He actually knew, because I've always said, in my opinion, this is rude to say, but probably 25% of Americans are batshit crazy. Would you agree with that or disagree with that?
Probably.
And final question: you went to Creighton Jesuit school, and you also go to Corpus Christi Catholic Church right around the corner.
Yes.
Have you been going there for 24 years?
Yeah, I have. Now, I went there for 5 years before I actually became a Catholic.
You went there 5 years before you became a Catholic?
Yeah.
Because my wife's went to
Catholic.
Creighton?
No.
You went to Creighton and you were a Catholic?
Yep.
I didn't think they let in the non-believers.
They'll take anyone that has money, Howard.
That was amazing. But I went to Creighton. I assumed they were all Catholic, but there were non-Catholics at Creighton. And,
yeah. Plenty.
Yeah. And I guess I never asked anyone. But so your wife is a Catholic.
Yeah. So she grew up, she was raised Catholic, went to diocesan or parochial schools.
And where were you born and raised, and where's your wife born and raised?
I was born in Seattle, Washington. My wife was born in Maryland.
Baltimore, Maryland?
Yep.
That's where the first dental school in the world, University of Baltimore, 1840.
So
first dental school in the world.
My wife is interesting because her father was an attorney, but he was the ambassador from Cuba to Denmark when Castro took over. And
ambassador to Cuba from Denmark.
He was an ambassador to Denmark from Cuba.
He was Cuban.
Yeah. And apparently he was not with he was anti-Castro. Batista wasn't any better, but he knew that Castro, the CIA at the time, from what I understand, and if this is going on the podcast, I don't know these to all be facts, okay? But apparently the CIA at the time did not trust Castro, So my father-in-law was actually feeding the CIA information about Castro. And then when he took over there in Denmark, they can't go back, because he would be killed, put in prison, whatever. But the United States did not have a way to get him into the United States either, really. So what they did was, I believe and my mother-in-law was pregnant at the time, so they're over in Denmark. She's pregnant with Anna, my wife, and her twin sister. And of course, at that time, they didn't know they were twins. They didn't have ultrasounds then. So they took them to Puerto Rico, and then got them into the United States. And they got them a job with an insurance company, and eventually that insurance company opened a branch in Puerto Rico, and they sent him down there. But get this, Howard, so he's 37 when this happens, doesn't speak any English, his wife is pregnant, and all of a sudden he can't go back home. He has to come to the United States and start completely over. And he was an ambassador. I mean, he was well-to-do. He has nothing. He has to learn. How would you like to be transplanted to a country where you can't speak the language, and you're a father, or going to be a father, and you're married, and you have no way to support your family? So, make a long story short, they finally get him into Puerto Rico, where they open this branch where you can speak, Spanish. And then they, at some point in time, come to Miami. And back then, when Castro, where a lot of people, it wasn't the refugees, it wasn't the Mario Boatlift, but before that, in the 60s, a lot of people escaped Cuba, got out. Most of them were professionals, attorneys, doctors, dentists. And they get here and they cannot practice their profession. So I think it was the state of Florida, I don't think it was Maricopa County, but anyhow, they made professional schools at night for these people to become, certified attorneys. He passed the bar exam, and they did the same thing for dentists and medical doctors. They made classes at night available for them so they could pass the boards and practice.
Nice.
But could you imagine?
Oh, I could. That'd be so sad. It was like when they were talking about Trump wanting to send these kids who are DACA, these kids carried over here as babies. They only know the United States. A lot of them only speak English. Anytime I send them back to a country they don't even know, that'd be like rounding us up and sending us to Mexico.
Yeah.
And that would just be, I'm sure we'd survive, but what a nightmare. That would be frightening. I don't even, and the other thing about going to a country we don't know the language, I watched criminal, I saw a study one time on criminality that, say you move to Brazil and you don't speak Portuguese. That 1 out of 100 sociopaths, you're like the wounded gazelle. You're like the lion. And it's like, so he sees you different from the whole herd because you don't know Portuguese. And so the sociopath criminals have a lot of extra tricks up their sleeve to separate you from the herd and steal you, rob you, murder you, whatever. Yeah, so it'd be like going out for a jog with headphones on. I mean, when you move to another country and you don't know the language, you're very
deporting those people is just wrong.
Yeah, at every level.
Yeah.
Well, hey, I want to tell you,
do we have a chance to somehow, when he edits, to get osteonecrosis in?
Oh, I did it right now.
I think that's something that's pretty big news in dentistry and oral surgery, and I think the community is becoming more aware of it. But basically, it's osteonecrosis, which is death of bone due to the osteoporosis drugs that women are taking.
Is that the one with Sally Field on the...
I think, what does she do? Beniva? And that is a bisphosphonate.
That's what we're talking about, bisphosphonates.
Yeah, bisphosphonates. And there's
We'll just call it
Fosamax.
Sally Field. What was that movie she was in when we were little, with Burt Reynolds driving a semi-truck of Coors beer across? You remember that movie?
Smokey and the Bandit?
Smokey and the Bandit.
Yeah.
That was Sally Field. So Sally Field is Beniva, bisphosphonates. So
Yeah, Fosamax is the most popular one, I think.
Fosamax.
Fosamax is the most popular one.
And tell them why people take Fosamax.
Basically for osteoporosis or severe osteopenia.
Which is what in English?
Their bones are becoming brittle, and they're prone to fractures. And it's, I think, mostly in postmenopausal women. So they start taking this drug to build up the strength of their bone. And it has a deleterious effect on alveolar bone. So it affects all bone, and what it does is it really decreases the turnover rate of bone. Okay.
But what is alveolar bone?
Alveolar bone is the bone that your teeth set in. So
like jawbone?
Jawbone. So jawbone has the highest metabolic turnover rate of all bones in our body because we're constantly chewing and there's forces constantly in that bone, and so those cells are turning over or changing more quickly than any other bone in the body. And so these bisphosphonates or Fosamax or Beniva, and there's other names too, what they do is they go in and prevent osteoclast, and an osteoclast is a cell that helps turn over our bone. Just like we get new skin cells, we get new bone cells.
So it slows down osteoclast?
Yep.
Slows them down or stops them?
Stops them.
Yeah.
Pretty much stops them. And so the problem is another one of the side effects of that drug is it decreases the blood supply to the bone as well. And we have to have blood supply to heal for anything. A cut on our arm, broken bone, whatever it is. If we don't have a blood supply to get oxygen to it and our healing nutrients to it, we won't heal. Okay? So if you've been on one of these bisphosphonates and you have a tooth that is pulled, you may have a non-healing wound that requires resection of part of your jaw.
Which is serious.
It's very serious.
How serious?
Well, there's been people who have lost their entire jaw.
Wow.
Or at least, 2 to 3 inches.
So what do you do? So now you're a postmenopausal woman over 55. You got this osteoporosis. You don't want to fall down and break your leg or hip, so you're taking a bisphosphonate like Fosamax. But now you have a root canal failing with gum disease, and she shows up on your door and needs this extracted. What are her options?
Well, different practitioners may do things differently. In my office, there is a blood test that I run that puts them into a risk category. High risk, moderate risk, low risk, no risk. And that is a controversial test, whether it's valid or not. But on the x-rays, if you have a thickening of the lamina dura, that is indicative that you may have osteonecrosis, or a widening of the PDL may be indicative of osteonecrosis. So the bottom line is, people have, if they're taking drugs, medications for osteoporosis, and they're going to their dentist, they need to make sure their dentist is aware that they're taking those medications. Okay. That's the main thing. All drugs have benefits and side effects. So this is one of the side effects of these drugs, but there's benefits to them as well.
Off the record, I know, on the tape, off the record, I know we're dentists and oral surgeons, but Americans are 5% of the Earth's population. They take half the prescription pills. So we have 324 million people out of 7.44 billion. If you were a postmenopausal woman at 50 years old and you were starting to get osteonecrosis, what do you think would be better for you?
For osteoporosis?
Osteoporosis. Taking a bisphosphonate or joining CrossFit and working out and exercising an hour a day?
Well, I think that exercises that are weight-bearing would be your first option. And you would do that for a period of time, and then you'd have another one of the, what do they call them, the DEX scans or whatever that measures osteoporosis. Have another one of those scans and see if that benefited you. Now, the FDA has come out also and said that these bisphosphonates, they show no benefit to people being on them more than 5 years. That's fairly recent. Within the last 2 years, they've said that. But people have been on these drugs since the time you and I have been practicing. And so some people have been on them for 10, 15,
I know.
20 years. But now, if you're on a bisphosphonate, you should really check with whoever's prescribing it, because the FDA says that they don't see any benefit after 5 years.
I'll tell you, 30 years in Ahwatukee. I've just seen it forever. I mean, this is totally anecdotal, but all I see, every one of my males that are 85 to 100 are on no prescriptions. And by the time you're 65 and you're on 5 different prescriptions, you're not living very long. Do you agree with that or disagree with that? They're calling it polyphagia, that by the time you're on 5 prescriptions, you're kind of on the Titanic going down. Because what I see is this, and maybe I shouldn't say this out of bounds, but it's like some people are told they have high blood pressure, so they lose weight, exercise, and eat less salt. And the other says, well, I'll just take a pill. I'll just go to Walgreens and take a pill. Some people, when they're told they're high cholesterol, they change their lifestyle, and others take a pill. And by the time your doctor has told you 5 things that are wrong, and here's 5 pills to be taken, you're really in danger. And the other people who, but if you say that, they say, what are you, some alternative holistic weirdo? You're an American. You don't have to exercise or eat right. You just take a pill. Do you see what I'm saying?
Yeah, it comes down, we talked about the opioid crisis earlier, and it's very similar. So giving someone a pill to treat diabetes is something different. If you're, a juvenile diabetic, okay. But if you're a type 2 diabetic, what is the cause of that diabetes? Is it your weight? Is your eating habits? That's really the etiology of it. The metformin or whatever is treating the symptom, but it's not really treating the etiology. Okay? That's my opinion, is that you really need to look at the etiology. If you have hypertension, is it because you're overweight, too much salt, whatever? If that's the cause, that's the etiology. Treat that. If that doesn't help, then go to blood pressure medications. If you have high cholesterol, is it because your body is intrinsically making cholesterol, or does some of it have to do with your diet? Now, most of the experts now are going to say that only 20% of the cholesterol that we actually have in our body comes from the diet. The rest of it is made. But why are some people having a higher cholesterol? Again, does it have something to do with, is your body just making it and that's where you're genetically programmed, or does it have something to do with lifestyle? I don't know the answer to that, but I would always try to holistically, as you put it, try to cure the problem before I go to medications.
There's 3 Mayo clinics. We're lucky to have one of the Mayo clinics, Scottsdale, Rochester, Florida. Mayo Clinic says that 92% of blood pressure can be treated by diet and exercising. Only 8% truly needs the medication. And then you give them the high blood pressure pill. So then that has side effects, maybe like erectile dysfunction. So now they're on a different medication,
Yeah.
and then it's just to be an American, there's just so many that say this is great. I don't have to change anything. I can have my Domino's pizza delivered and just take a blue pill. And that's not really the answer, is it?
No, it's not. But that is, unfortunately, our society from the standpoint that we have become complacent and, for lack of a better way to describe it, lazy.
Well, actually, I saw the neatest statistical correlate. You put obesity here and all these other factors here. You know what? And you go around the globe because you learn so many things about your own tribe by getting out of the United States and seeing other tribes. Because when you're born, raised, reared, and lived in the United States, you think that's the whole world. Guess what the number one correlator? Because Americans say the number one correlator to obesity is high fructose corn syrup. All these things. But I like economists where they just say, this is measured as out. Guess what the number one correlator was to obesity for around the world?
I don't know.
The automobile.
Makes sense.
You go to all the societies where they have to walk to the market, walk to wherever they're walking. there's no obesity.
Which basically says exercise.
Yeah, and I live 3 miles from my house to my dental office. You go to Denmark, Scandinavia, 100% of the dentists that live 3 miles from work would walk to work and back every day, and it wouldn't even cross their mind to get in a car. If they were like 5 to 10 miles away, they'd say, you know what, I'm going to ride my bike.
Yeah.
And when you say a car, I mean, you'd have to be at a distance of over 10 miles before that would even ring a bell, or I have to carry something that wouldn't fit on my bike. And in America, what percent of people who live 3 miles away from work walk to work?
1-2% maybe?
Yeah, and what percent that are 10 miles away ride their bike?
0.
I know. And then we want to blame it on Coke and Pepsi. And I've been to Denmark and all those countries, and they have McDonald's too, but the difference is they don't have a drive-through. Everybody walks to McDonald's, eats their hamburger, then walks home, and out in front of the McDonald's is maybe a bike rack with like 20 bikes in it.
Yeah. But think of this though, Howard, when I was growing up, if we went to McDonald's once a month, that was a huge treat.
Yeah.
I mean, it was a big treat. But, and I'm sure, and I can ask you about your kids. I mean, Ryan's not overweight, but when we were growing up, there was 3 stations on TV, ABC, NBC, and CBS, I'm assuming. There was nothing to do in the house. We were outside playing all the time, all day, in the summertime. We just had to be back for lunch and back for dinner. That's it. And now we get in today's society, and Phoenix is a little bit different, okay, because of the heat, in the summer and stuff. But we're afraid to let our kids go out because of all the terrible things we hear on the news of child abductions and, all that kind of stuff that goes on. Computer games. We didn't have that. We had to go out and we had to use our imagination, number one, to have fun. We had to make things up and play games. They don't have to do that anymore.
On that note, my gosh, we went an hour and a half. You are an amazing man. Thank you so much for helping our community for 24 years. Thank you so much for being the person we refer our wisdom teeth and implants place, for teaching me and our staff CPR every year. You're an amazing man, and thank you so much for coming by today and educating my homies in Ahwatukee.
Well, thank you very much, Howard.
All right.